Hello, my name is Amelia. I'm from 12th Science 2 and today I want to tell you about smoking effect. Smoking is a hard habit to break because tobacco contains the very addictive chemical nicotine. As with heroin or other addictive drugs, the body and mind quickly get used to the nicotine in cigarettes. Soon, a person needs to have it just to feel normal. People start smoking for different reasons. Some think it looks cool. Others start because their family members or friends smoke. Almost all adult tobacco users started before they were 18 years old. Most never expected to become addicted. That's why it's so much easier to not start smoking at all. Chemicals and turn them into a vapor that's inhaled by the user. Some people think that e-cigarettes are safer than regular cigarettes because they don't contain tobacco, but the other ingredients in them are dangerous too. In fact, there are reports of serious lung damage and even death among people who use e-cigarettes, so health experts strongly warn against using them. Hookahs are water pipes used to smoke tobacco through a hose with a mouthpiece. Some people think they're safer than cigarettes because the smoke cools when it passes through the water. But look at the black gum that builds up in a hookah house. Some of that gets into user mouths and lungs, and since they don't have filters and people often use them for long periods, their health risk might be even greater. Hookahs are usually shared, so there's the added risk from germs being passed around along with the pipe. Many of chemicals in cigarettes, like nicotine and cyanide, are poison that can kill in high doses. The body is smart; it goes on the defense when it's being poisoned. First-time smokers often feel pain or burning in their throat and lungs, and some even throw up the first few times they try tobacco. Over time, smoking leads to health problems such as heart disease, stroke, lung damage, many types of cancer, including lung, throat, stomach, and bladder cancer. Other problems include gum disease, yellow teeth, eye disease, and an increased risk for infection like pneumonia, a greater risk of diabetes, weaker bones that are easier to break, skin problems like psoriasis, or a type of rash, a wrinkled skin, ulcers. Smoking can affect sexual health in both men and women. Girls who smoke and are on hormone-based birth control methods like the pill, the patch, or the ring have a higher risk of serious health problems like heart attacks. And if a woman wants to get pregnant, smoking can make that harder. Besides the long-term problems that chemicals in cigarettes and other products also can affect the body quickly, teen smokers can have many of these problems. Bad breath. Cigarettes leave smokers with a condition called halitosis or lasting bad breath. Bad smelling clothes and hair. The smelling of stale smoke tends to last not just on people's clothing, but on their hair, furniture, and cars. It's hard to get the smell of smoke out. Troubling keeping up in sports. Smokers usually can compete well with non-smokers. Physical effect of smoking like a fast heartbeat, decreased circulation, and shortness of breath harm sports performance. Greater risk of injury and slower healing time. Smoking hurts the body's ability to make collagen. So common sports injuries such as damage of tendons and ligaments will heal more slowly in smokers than non-smokers. Increased risk of illness. Studies show that smokers get sick more with colds, flu, bronchitis, and pneumonia than non-smoker. And people with some health condition like asthma get sicker if they smoke, or if they just around people who smoke. Teens who smoke as a way to manage their weight often light up instead of eating, so their bodies can lack the nutrients needed to grow, develop, and fight off illness well. All forms of tobacco, cigarettes, pipe cigarettes, hookahs, and smokeless tobacco are health hazard. It doesn't help to substitute products that are advertised as better for you, such as e-cigarettes or filtered or low-tar cigarettes. The only thing that really helps is staying away from all these products. This isn't always easy, especially if everyone around you is smoking or vaping. It may help to have your reason for saying no ready for times you may feel the pressure. Try, I just don't like it, or I want to say it in shape for soccer or football, basketball, or other sport. When you smoke, the poisons from the tar in your cigarettes enter your blood. This poison in your blood then make your blood thicker and increase change of clot information. Increase your blood pressure and heart rate, making your heart work harder than normal. Narrow your arteries, reducing the amount of oxygen-rich blood circulating to your organs. Together, this change to your body when you smoke increase the change of your arteries, narrowing and clot forming, which can cause a heart attack or smoke. Smoking damages your heart and your blood circulation. Increase the risk of conditions such as coronary heart disease, heart attack, stroke, peripheral vascular disease, or damaged blood vessels, and cerebrovascular disease, damaged arteries that supply blood to your brain. Carbon monoxide from the smoke and nicotine both put a strain on the heart by making it work faster. They also increase your risk of blood clots. Other chemicals in cigarette smoke damage the lining of your coronary arteries, leading to furring of the arteries. In fact, smoking doubles your risk of having a heart attack. And if you smoke, you have twice the risk of dying from coronary heart disease than lifetime non-smoker. The good news is that after only 1 year of not smoking, your risk is reduced by half. After stopping for 15 years. Your risk is similar to that of someone who has never smoked. Smokers have an increased chance of getting stomach cancer or ulcers. Smoking can weaken the muscles that controls the lower end of your gullet or esophagus and allow acid from the stomach to travel in the wrong direction back up your gullet, a process known as reflux. Smoking is a significant risk factor for developing kidney cancer, and the more you smoke, the greater the risk. For example, research has shown that if you regularly smoke 10 cigarettes a day, you are 1.5 times more likely to develop kidney cancer compared with a non-smoker. This is increased to twice as likely if you smoke 20 or more cigarettes a day. The good news is when you stop using the tobacco, even after many years of use, you can greatly reduce your risk of developing head and neck cancer. Once you have been smoke-free for 20 years, your risk of head and neck cancer is reduced to that of a non-smoker. If you do smoke or vape and want to quit, you have lots of information and support available. Different approach to quitting work for different people. Some people find that it helps to go to a support group, especially for teens. When quitting, know that the first few days are the hardest, so don't give up. So some people find they have a few relapses before they manage to quit for good. Staying smoke-free will give you more energy, better looks, more money in your pocket, and in the long run, more life to live. Thank you, Miss Rahmat.